Music is weird. They're all quitting.
Hey everybody, looks like we have a few participants. It is just about 10:30, so we're going to give it a couple minutes before we go ahead and get started. I'm Dustin Pugel. I'm Senior Policy Analyst with the Kentucky Center for Economic Policy, and I'll be hosting our panel today. So we're just going to give it a little more time, like I said, let folks find their way in, and then we'll go ahead and get started. Looks like we have some more folks trickling in. Just want to welcome you and say that we are going to get started here in just a few minutes. Looks like it's a little after 10:30 and we've got about 20 attendees so far. I know we've had a lot more sign up, so we're going to give that a few more minutes before we get rolling here. Welcome new attendees. Just want to let you know you are in the right place and we will be getting started here soon. Looks like we're around 30 folks who have joined. I know there are quite a few more who signed up, so probably give it maybe a minute or two more before we get started. All right, well, welcome attendees. I'm so glad that we're able to have a conversation today about the safety net. My name is Dustin Pugel. I'm the Senior Policy Analyst with the Kentucky Center for Economic Policy. And I am joined by two really phenomenal experts today that I have learned much from and I'm excited to hear from and hear in a little bit. This is the last of our series of webinars that we've been doing in lieu of our conference to try and make sure we are all safe from coronavirus. So we wanted to sort of wrap up our sort of virtual conference, so to speak, with a discussion about Kentucky's safety net and social insurance programs, specifically unemployment insurance, and really talk about the ways that that has been useful in maintaining economic security during the pandemic and the subsequent downturn, but also ways that we can protect it from potential cuts and really enhance it so that in future emergencies we are ready to face those well. So I'm going to present a little bit just shortly to tee us up with a little bit of the economic background that we're facing, and then I'm going to hand it off to Michele, who's going to talk a little bit about our unemployment insurance program, then followed by Betsy, who's going to talk a little bit about our safety net here in Kentucky. And then we're going to open it up to some Q&A so that folks can ask some questions. And really, our hope today is to present a lot of information that will not only help us in understanding the safety net and unemployment insurance better, but also prepare us for the General Assembly and any potential legislation that will come out of this. As I know a lot of legislators are thinking carefully about, what do we do and how do we improve or how do we change the safety net so that advocates and analysts and community members are informed and able to understand really what those changes might mean. So with that, I'm going to go ahead and share my screen and present just a little bit of background information so that we're prepared to really absorb what Michele and Betsy are going to share with us, and then we'll continue with the presentation. So like I said, I'm Dustin Pugel. I'm with the Kentucky Center for Economic Policy. We are a nonpartisan nonprofit research group out of Berea that works on state policy here in the Commonwealth, primarily to try and find ways to make sure that policy is working for everyone, particularly low income and middle income Kentuckians. So for those of you who were a part of our race equity conversation a couple weeks ago or a week ago, this will look familiar to you, but I think it's important for us to just kind of step back and think about where we were, entering into this recession. The main point here I want to make is that we had almost recovered, but not quite, from the Great Recession by the end of 2019, beginning of 2020. And at the same time, there were a lot of racial and ethnic disparities that never closed and may have even gotten worse in some cases. So, for example, even though the labor force participation rate, meaning the participation rate of folks in the labor force, either employed or looking for work, even though that's higher for Black and Hispanic or Latino Kentuckians, the unemployment rate was higher in 2019. And it's stayed higher throughout 2020 and now into 2021. The poverty rate was much higher and has been historically for Black and Hispanic Kentuckians. Median wages are lower for Black Kentuckians than they are for white Kentuckians or on average. And this is not a surprise based off of historical barriers and explicitly racist policies like slavery, the so-called Southern Redemption, Jim Crow, mass incarceration, law and order policies. These are all things that have very explicitly led to serious economic and other types of disparities. And then just based off of intergenerational income mobility, the fact that if you're born into a poor family, you're more likely to be poor. If you're born into a rich family, you're more likely to be rich. Those disparities have really been hard baked into our economy. And so this is what we went into a very serious pandemic and downturn with. And at the same time, employment during the downturn was really hard on low income and middle income Kentuckians. If you are well paid in Kentucky, you've seen a recovery and you saw it pretty quickly. For everyone else, there is a pretty significant downturn. For workers making between $27,000 and $60,000 a year, as of October, the latest data we have available, employment was down 5.5%. And for low-income workers, workers making less than $27,000 a year, employment was down 15%. Now, there was an initial bounce back after the CARES Act stimulus checks and enhanced unemployment benefits. But when that money ran out, the recovery faltered. Now, we don't have data yet on what the most recent round of relief has meant for folks. So I imagine it will have helped, but the reality is that for most of 2020 and into the beginning of this year, things have been very difficult for low income and middle income Kentuckians. It's also important to remember that for the entire adult population, half of Kentucky adults reported losing household income since March of 2020. So this has been a very far-ranging downturn that has affected a lot of folks. But it has affected Black workers and low-income workers more. Unemployment insurance data shows that in Kentucky, Black workers have been laid off at a higher rate, and they've been slower to be hired back since then. And so the result is from census data that has been routinely produced either weekly or biweekly since near the beginning of the pandemic, that now 1 in 5 Kentucky adults say they don't have enough food to feed their children. 1 in 5 Kentucky adult renters have past due rent or rent-based debt that they are at risk of eviction over. And then over 1 in 3 Kentucky adults say that they can't pay all their bills right now. They're having difficulty paying for usual expenses. So,
It looks like Dustin has frozen for a second, so we will wait just a moment to see if maybe he can go off camera. His computer might catch up with us. So just a moment, please. Thank you.
okay, can you hear me now?
Yes, you can.
Okay, can you let me know where I froze? On the yellow slide, okay, thanks, Anna. So let's go back. We'll share this again. So my point here was that there's a lot of hardship that state and federal policies have done some work to alleviate, and in some cases successfully, but a lot of that has run out, and there's much more that needs to be done. There are ways that we can improve our safety net and unemployment insurance so that in the future we don't hit the kind of lows that we've hit over the last several months. And at the same time, we're coming fresh off the heels of legislative attacks to programs like food assistance, medical assistance, basic cash assistance, and unemployment insurance in recent years through trying to restrict who can use these programs, how long they can use these programs, the value of unemployment insurance benefits. So I think it's important, especially as we restart the legislative calendar here next week, that we're all aware of the importance of these programs, why we have these programs, and ways that we can enhance the programs to work for everyone and also defend against serious cuts. So to that end, I just want to introduce our 2 panelists for today. The first is Michele Evermore, who's a senior policy analyst with the National Employment Law Project. Michele joined NELP in 2018. And in this role with NELP, she works with states to improve their unemployment insurance systems and public sector pensions. On the federal level, she's worked for a more inclusive and sufficient unemployment insurance system, leading to key protections for unemployed workers during the COVID-19 pandemic. And in addition, she's worked with both national and state level worker advocacy groups to assist with their capacity to mobilize workers to achieve the kind of lasting structural changes that can only be accomplished through movement building. In the past, Michele has worked to promote worker power as a legislative advocate for labor unions, including with the SEIU and the National Nurses United. She also worked for the Obama Department of Labor to advocate for sound benefits policy, employment policy for people with disabilities, and equal pay for equal work. Prior to that, she worked with Congress for a decade. Michele has also testified before the Senate Finance Committee and the House Oversight Special Select Committee on the coronavirus, and is fresh off what she referred to me as her other job, working for the Biden transition team. And on a personal note, Michele has been immensely helpful to me as an advocate and an analyst around unemployment insurance, really just understanding the programs well and being able to advocate better here in the Commonwealth. Our other presenter today is Betsy Davis-Stone, who's a health law fellow with the Kentucky Equal Justice Center, where she advocates for equal access to quality healthcare across Kentucky by litigating cases, networking with policymakers, educating community members, and actually directly enrolling people in Medicaid and healthcare.gov plans. Before joining KJC, Betsy worked as a senior staff attorney for Apple Red Legal Aid Clinic, where she focused on consumer, housing, and public benefits issues faced by low-income Eastern Kentuckians. And prior to Apple Red, she held judicial clerkships in the Fayette County Circuit Court and the U.S. District Court in Lexington. Betsy currently lives and works in Lexington, but she's originally from Western Kentucky, and she received her undergrad degree from Union University in Jackson, Tennessee, and her law degree from here at the UK College of Law. I consider Betsy a really close colleague and a supremely competent and effective Kentucky safety net advocate. I think Betsy brings a really amazing set of skills as someone who works very closely with folks who are using programs like SNAP and Medicaid just to get by, with a really profound understanding of the policy, so that she can really speak from a place of experience and how these policies actually affect people's lives. So with that, I'm gonna stop sharing my screen and hand it over to Michele, who's gonna give us a really good presentation on unemployment insurance.
Hello, everyone. It's so nice to be here. One thing that Dustin didn't mention is that I'm a huge fan of Kentucky. I'm actually a Kentucky Colonel. So I'm really excited to be on this webinar this morning. I am going to not use slides. I'm going to try and make this very conversational and try to keep an eye on the comments because UI is difficult. It's complicated, and I want to make sure that I'm actually saying things that matter and make sense to you. So I'm going to start 10,000 feet up. What is unemployment insurance and why is it important? Well, unemployment insurance replaces some portion of your prior income. And the purpose of UI, when you become involuntarily unemployed, the purpose of UI is to keep people from starving when a job is lost, right? That's the first reason, and that's the most obvious reason to most people. But there are other benefits and other things that are baked into the system. First is an attachment to the workforce. When you apply for unemployment insurance, you're also applying for employment services and that sort of connection to the workforce. You're required to be actively seeking work, and there is a correlation between duration of unemployment and finding a better job when you leave unemployment. And that's because unemployment insurance establishes something called a reservation wage, so that you don't have to take a much worse job the minute you lose a job that's suitable for you. And what that does is, in society, keeps recessions from driving wages down. And then finally, and probably most important for our conversation here and the moment that we're in, is it's a macroeconomic stabilizer. So what that means is, whenever unemployment insurance, whenever there's a recession, people don't lose all of their buying power. And so, every dollar spent in unemployment insurance in the last recession generated about $1.61 in local economic activity. That's really important. And so one of the questions that I'm hearing a lot from Kentuckians is, the trust fund has run out of money. What does that mean for us? Well, first of all, it doesn't mean anything for you getting a benefit right now. the state has promised you a benefit. You will continue to get that benefit as long as you are eligible. And, do not panic right now about the state borrowing. Kentucky was only 57% funded at the start of 2020. Some other statistics about Kentucky's system is that about 20 in 100 unemployed people were able to access a benefit. That is too low. It should really be more like around 50% of unemployed people able to access a benefit. And that benefit replaced, as of 2019, about 44% of wages. Again, that's a little low. It should replace more like 50%. And, going forward, we've found during this recession that replacing a huge amount of income doesn't actually result in people being unwilling to take work. So we could raise that to 60, 70% of income as incomes are dropping. And one thing that I've noticed, particularly in Kentucky over the course of this recession, is the average weekly benefit amount has been going down and down and down, which means the poorest people are unemployed, the people with the least means and the people who need a benefit the most. So in the third quarter of 2020, the average weekly benefit was $281.67. But in quarter one, the average benefit was $383.60, so almost $100 more per week. That's a huge drop. So, like we usually see, the longest term unemployed people are people of modest means. I also want to highlight that, there are definite racial components here. Unemployment insurance tends to be less generous in states with the most Black, Latinx, and Indigenous workers. And particularly, Black and Asian American workers are more likely to be long-term unemployed, and their duration of unemployment is higher. So, duration of unemployment actually is a racial justice issue, as well as being, a good conscience kind of thing to do. Getting back to the trust fund. So I somewhat expect that Congress will eventually come up with a bailout. I mean, the U.S. Chamber of Commerce and the National Governors Association, as well as NELP, are asking Congress, since the trust funds have run out, can we consider just restoring trust funds to where they were at the start of the pandemic? I expect that to be tied to some requirements that states do better in terms of coverage. But I think that panicking about the trust fund right now is premature. What happened, and I'm going to get into this later, but what happened after the last recession is that when state trust funds were depleted, that actually created emphasis. It made states want to cut benefits, and so many states cut benefits in many ways, and we can't fall for that now. I'm going to leave it there now, and I'll go into how states cut benefits. But I want to talk just for a minute about what's happening in this moment. So, at the beginning of the recession, administrative funding for FY 2020 was less in absolute dollars than it was in 2001, not accounting for inflation, not accounting for population growth. And so states didn't have the resources to deal with any recession. But then, the third week in March, there were 3.3 million new claims and 6.6 million for 2 weeks after that, 5 million after that. We're still over a million new claims a week. This many weeks into the crisis. By way of comparison, the highest number of new claims in history before the pandemic was 695,000 in October of 1982. So we've just seen this immense strain on the system. So in March, Congress passed the CARES Act. That added several new programs: pandemic unemployment assistance, which is parallel to unemployment insurance, but is only available to people who don't qualify for regular unemployment insurance. It added 13 additional weeks of benefits called PEUC, Pandemic Emergency Unemployment Compensation, And then there were $600, there was a $600 bonus added to every check, no matter what kind of unemployment insurance benefit you get. And that's called Federal Pandemic Unemployment Compensation, or FPUC, because these, these acronyms are so fun. So the $600 only extended to the end of July. At the end of July, the president signed a memo giving states $300 extra per person through September 5th. And then after September 5th, people went back to their regular low levels of unemployment insurance. And at the end of December, all of those benefits ran out. So Congress added an additional 11 weeks of eligibility for all programs and an additional $300 a week up through the week of up through March 14th. My concern here is that adding eligibility and adding to the benefit amount is really helpful right now, but it papered over some really deep problems in the system. So I'm going to do a little bit of table setting here and talk about what are the components that you have to think about when you think about where to add and where to cut, or where other people are going to try to cut, I should say. Absolutely nothing about Kentucky's unemployment insurance system should be cut. It's already, not reaching enough people or paying enough. So first of all, you want to think about eligibility and accessibility. So how much money do you have to earn to get benefits? What are the reasons that you can get benefits? What are the reasons to quit and get a benefit? Is there sufficient protection for people to quit over health and safety violations, for example? What about people who are experiencing domestic violence, right? They should be able to quit and still access unemployment insurance benefits to escape a terrible situation. The problem here is roughly half of people getting a benefit in 2020 got it through PUA, the additional pandemic unemployment assistance, which means that they were by definition ineligible for UI, which means unemployment benefits are only getting to about half the people they should. We really need to think about how to make sure that people get benefits. And this is both legislatively and administratively. The second component obviously is, does it pay enough? And in Kentucky, no, it does not. Again, when we added an additional $600 to base benefits, we still found that 70% of people who were taking work took it while they were getting the extra $600. And so, during the pandemic. So clearly it wasn't a disincentive to people taking jobs. The third component, and this is where people sometimes tend to fall off, but it actually is one of the most important things, is financing, the tax rates, the wage base. So, right now in Kentucky, the wage base is only, oh shoot, I pulled up the wrong slide here, sorry. I should have this off the top of my head. In Kentucky, benefits are only taxed on the first $10,500 of wages. Some states tax up to $49,000 in wages. And the thing about increasing the amount of wages that the benefit that the tax is based on is you can raise that amount and then cut rates, and it makes it a lot more progressive. A well-financed unemployment insurance system is going to show up for people. A system that is not well-funded is going to run into problems when there's a recession, and there's going to be pressure after the recession as taxes go up to cut benefits. So financing is incredibly important. Another thing that sounds really boring, but the devil is in the details, is administration. We all saw those long lines, right, when Kentucky opened up those offices in the summer. Because Kentucky's creaky IT infrastructure just failed people, and it's not just in Kentucky. Every state's computer system was overwhelmed. We really need to be thinking about not just the computers, but what are the hurdles that we're throwing up to access? I think even in states that didn't legislatively pass a lot of cuts, we saw access to benefits decrease in almost every state in the last 10 years. And the reason for that is, in large part, states started paying so much attention to overpayment that they didn't care anymore about timeliness as much, or about inaccurately denying people. So we saw denials double in the last 10 years. Inaccurate denials have doubled. So we really need to look at all of the, everything from the user interface to the black box algorithms that are stopping people from getting benefits, and really, spend some time thinking about that this next year. The other thing, as I mentioned earlier, unemployment insurance provides attachment to work. And so we need to be thinking, especially this year, about how do we make reemployment services stronger? And how do we really focus more on making sure that people, have help with their resumes, that people with limited English proficiency have help navigating the system, things like that. When you have quality reemployment services available to people, then they get back to work a lot faster, and they find a job that's better for them. And that's good for employers and employees when people find jobs that are a good fit, right? The next component should probably have been the first thing I mentioned, and that's equity. California Policy Lab found that even though it's much more difficult for Black and Latinx workers to receive benefits, the share of Black workers within the workforce recertifying for benefits in California, at least, is 2.5 times the share of the white workforce claiming benefits. This is a really important benefit to communities of color, and we have to really make sure that this is a sufficient benefit if we're going to ever, think about achieving any sort of racial equity. And finally, this is another thing that, to some people is really boring, but we have to make sure we have good data. And, over the last year, data has been difficult. Data collection has been difficult. And we just haven't had good information about who's getting benefits and how and why. And so you can't manage what you don't measure. And so over the next year, I think we need to really think about that. I'm just going to do a time check, and just Dustin, if you could let me know how much time I have left, because I want to make sure that I get to everything.
I think you're good for another 5 or 10 minutes.
Okay, perfect. So getting down to the issues that we're going to be facing in the next year. So in 2019, Dustin and Jason helped to stop some really bizarre legislation that would have actually tiered back benefits as time goes on. So the longer people are in the system, the less they get a benefit. So as I pointed out, the duration of unemployment is actually highest for Black workers and Asian workers. And so, that is, it has a big racial impact. And so luckily, we were able to fight that off. But, Kentucky already cut benefits significantly in 2010. The benefit rate was reduced from 1.185% of base wages to 1.3% of base period wages. And a waiting week was added. So, this means that Kentucky was already on weaker footing going into the last recession. So, what other states have done and what you can expect to see is an attack on the number of weeks. So in the last 10 years, 10 states reduced benefits below 26 weeks. That seems to be low-hanging fruit. And then there are continuing eligibility requirements that states have enacted. So increasing work search, increasing, there was a question in the chat about suitable work. If you change the definition of what is suitable, what you have to accept, then people get kicked off the rolls. In some states, they've said basically, okay, early on in your unemployment, you can hold out for a job that pays 80 or 90% of what you made before, but as your weeks go on, you have to accept less and less and less. So that's been a problem. So you have to pay attention to these little details, these continuing eligibility requirements, documentation requirements. In Florida, for example, when they implemented the new computer system, they added a 45 question initial skills assessment to the questionnaire. They're going to be looking for hurdles to access. Already access is too low. So, I think pushing in the other direction would be very helpful. And again, looking at making sure that the state is focusing not just on overpayment prevention, but that it's also really trying to meet all of its other goals, like timely payments, accurate appeals assessments, that denials are not excessive. And so, yeah, so the other thing that's probably going to happen in Kentucky in the near future is going to be happening everywhere is, that they'll be looking at IT modernization. I always put modernization in scare quotes because a lot of the states that I've seen that have modernized have done so in a way that has actually made it harder for people to get benefits. Florida's system, for example, one of the worst systems, is a modernized system. So making sure that there is actual user input in the modernization process is really important. And I see a question here in the chat, why has data collection been difficult? So it's just been the crush of people entering the system has made it really hard to determine things like, what is recipiency? We don't know right now. And that's because states that took a long time to pay out claims are sometimes paying 10, 12, 16 weeks of claims all in 1 week. And so that looks like 10, 12, or 16 people all getting a continuing claim that week. And it doesn't work that way. So for example, recipiency in California for the third quarter of 2020 was 2,800%, which I have a hard time believing. And so just in closing, I'm gonna answer a couple of these questions in the chat. Tyler Offerman asked what about the guidance from labor on the recent executive order. So we don't have guidance from labor yet on that, but let me get into that a little bit. When I was talking about suitable work, you don't have to go back to any job. It has to be a suitable job. And presumably if your boss calls you back to your old job, that's suitable because it's exactly the same as you had before, except in the era of COVID. You may be asked to be going back to a workplace that's far less safe. And so we hope that the Department of Labor comes out with good guidance, making it clear that people can refuse unsafe work. And we have a raised hand. I would, yeah, if you want to come off mute, that would be great.
Brenda, I see that you've popped up there, but it looks like you're still muted if you're trying to talk.
Now you're off mute, Brenda.
Yep.
That was by accident. I didn't mean to turn that on.
Oh, gotcha. Okay.
Oh, okay.
We have another question from Sherry, which you can answer now, or if you want to take some time to look at it, we can come back to it after Betsy's presentation.
Yeah, I just looked at it while we were waiting for the raised hand. So yes, this is the biggest issue. She's talking about small business folks and people who otherwise don't have access to unemployment, people who have barriers to filing online. I think, there are a couple of things that can happen here. First of all, online systems should be a lot easier. They should be mobile accessible. you know, they should be easy to understand, but there should also be plenty of access to being able to call in, you know, to open offices once this is all over. And, you know, the other thing that I've been talking to folks about is the idea of navigators, of like, you know, people who are in unions are twice as likely to apply for benefits and twice as likely to receive benefits. If we could find some way to give unions a little bit more of a role in walking people through the system, I think, and we're talking about doing that in several other states, I think that could be really helpful, or some other like claimant friendly group, to actually just have funding to just hold people's hands through the system. I think that could be enormously useful.
Great. Well, thank you so much. As folks as we continue through the presentation, if folks have additional questions, please put those in the Q&A and we'll come back to them at the end. But now I'd like to transition over to Betsy.
Hi, everybody. So I am supposed to talk a little bit about how we get a robust social safety net just overall in the state of Kentucky. And so I'll talk a little bit about federal and state policy. And it's seemingly the perfect time to talk about the social safety net. We always want to talk about the social safety net, and it seems the most important when we're experiencing a collective crisis, like a joint pandemic and economic downturn, for instance. That said, I just, underlying all this, want us to be mindful that to have a robust social safety net, it's really important to make sure the net is secure before, not during the crisis, even though we often only want to invest in and work on it during the crisis. Just like if you're a tightrope walker, you really want to make sure the net below you is secure before you walk out on the rope, not once you're getting wobbly in the middle. And sometimes it feels like we're tying together loose ends when we're wobbly in the middle, rather than investing in the system throughout the time. So I'm going to talk today about some things we have done and should do to strengthen that safety net, but I do just want to start by acknowledging some of the assumptions that got us here. So I am not going to get deep into unemployment because you just heard from an expert on unemployment. I'll talk about other benefit systems. But when Michele was talking about the UI system sort of crashing essentially here in Kentucky last year, I was reminded of all the long wait times, nobody being able to get a hold of anyone, everyone being outraged. There was a lot of finger pointing, as I'm sure you'll remember, and a lot of people just overall questioning, understandably, why our systems don't work. And call me jaded, and I probably am, but I was thinking these systems have always worked this way, which is not worked a lot of the time. And it definitely is worse right now. You've seen the numbers that Dustin presented to you at the beginning of this, and you probably didn't need to see his slide to know that unemployment was at an all-time high and still is very high. But I think what was happening really at the beginning of that crash was a lot of people were experiencing the social safety net not working for the first time, but it's not like it was always working for people before this. We're not strangers to long wait times at public benefits offices. There's always been lots of paperwork associated with applying for benefits. Frequently, there's been lots of paperwork that gets lost. Those things have always existed. And if there's anything that I've learned in a public policy role, it's that systems work the way they're designed to work. We have the ability to make those systems better. I'm sure that if we were in person and I split you all into groups and asked you to fix or to propose ideas for how to fix these problems, you'd come up with ideas because a lot of these are really common sense fixes, right? If you fund more call center workers and train them better, you probably won't have hours long wait times. You all would come up with that. So it's not that we don't have the ideas for how to fix things, although I'm going to talk about some of the policy proposals that could fix things better. But often I think we choose not to invest in the social safety net and in these public benefits programs as much as we should because we don't think we're the type of person who will ever need these systems. Or sometimes I think that there are people that are sort of actively undermining or attacking the social safety net. We've seen that in the last few years. And I think that often underlying that is the idea that the people that use these systems don't deserve to use them or aren't worthy of using them. And I'm going to talk some about how that really tears apart the system and makes it so that people don't get the help they need when they need it. And all of those assumptions are how we end up with something like a UI system crash, where we've just underinvested in something for a long period of time. So I was feeling all of these sort of negative feelings about how do we fix these things and how do we take good care of our neighbors and use the dollars that we do have to be productive and take care of people with them on election day. As I'm sure many of you were, it felt like it was building up until that time. And then I gave birth to what I think is a very beautiful baby girl on election day. And may I just say that there's nothing to make you feel hopeful on election day like giving birth. I highly recommend it. That said, I'm telling you that now because I just got back from maternity leave 2 days ago. So I want to start with just a disclaimer of telling you that things in public benefits world change daily. And so feel free to correct me in the chat, or I'll defer specific questions of things I'm not quite up to speed on if I make a misstep. That could happen today. But I just want to say before I jump into the nuts and bolts of what are we doing and what could we do specifically, that in order to make the social safety net robust, all of us have to think of the social safety net as something for all of us, that any of us could need at any point in time. The social safety net is not a picky date. It doesn't have a type. And this attitude that the social safety net is only for certain people, for maybe these stereotypes of people that public rhetoric has shaped that often don't really even exist. It's not just bad because it means that we have a failing system that doesn't serve those people. It's also bad because the people who need assistance the most are often the people that are least likely to even try to get it because of those stereotypes that we've created. What do I mean by that? Dustin told you that I used to work in legal aid and represent more individuals before I started at KEJC. And I had most all of my clients would have qualified for some sort of public benefits program in one form or another. But I had so many clients that were not taking advantage of the public benefits that they qualified for either, because they had used the program in the past and it was so much paperwork and so much bureaucracy and so much trouble to try to stay on the program, particularly with a full-time job, that they just gave up. But another category of people were people that showed up in my office and felt the need to convince me that they weren't the type of person who used public benefits. And you know, that doesn't just come about by happenstance. Someone has taught them that, and it's the way that we talk about needing help or using public assistance. It's the way that we talk about it and put shame on people for needing to ask for help, even though we train little kids to do that, right? If you need help, ask for it. Don't try to do things by yourself that you just can't do. And so a lot of how do we fix the system, I think, is really like changing the way that we think about public benefits and encouraging people. I think Dustin mentioned sort of the unwelcome mat earlier, rolling out the welcome mat and saying, we want you to take advantage of services when you need help so that you can get back on your feet and so that you don't have to stay in this place where you're at right now. So with that, I'm going to jump in really quick to some affirmative steps that I think we need to take to make the safety net more accessible. And like I said, I'm just staying away from unemployment because you just heard from somebody about that, but obviously that's an important part of this. So let's start with health insurance because it is a pandemic. So we have this joint problem here of people are losing their jobs, which in the US, because so much health insurance is tied to jobs, when people are losing jobs, they're losing health insurance, and they're losing health insurance at the worst possible time, right? You want to have health insurance, not only from an individual perspective during a pandemic, but also healthcare providers want you to have health insurance during a pandemic because they want to be reimbursed for the services that they're going to have to give you during an emergency situation. So I really want to take some time to pat on the back, I guess, Kentucky's Cabinet for Health and Family Services and our Department for Community-Based Services, because they've really taken some creative and novel ways during the pandemic approach this and try to make this better and try to sort of save off a lot of people not being insured during this time. And a good measure of that is that in the state of Kentucky, we've had some of the highest Medicaid enrollment rates in the last year than any other state. To a lot of people, that sounds bad. And that is theoretically not great during like an economic upswing when people should be able to, when people should have income that's higher than 138% of the poverty line, which is the Medicaid guideline. That said, the reality is that right now we want people to be enrolling in Medicaid because we know that so many people are going from income to zero income because they're losing their jobs. And so if we want them to be insured, the place for them to go is Medicaid. So Kentucky CHFS has essentially made that possible by expanding presumptive eligibility, which was a mechanism in Medicaid before the pandemic, to a lot more people. The way they've done that is before PE or presumptive eligibility, it's also being called temporary Medicaid or special coverage right now. Before it was mainly only accessible at hospitals. If you came into a hospital and you were uninsured, it was a mechanism where the hospital could fill out a quick form, get you approved temporarily for Medicaid, and then later you could come back in and do the work that you needed to do to get enrolled using the full application for Medicaid. And essentially what we've done is we've put a simplified form like that online and made it accessible to everybody, regardless of your income. So you can start with temporary coverage and get that right away. So you can get the health benefits that you need right away before you go through the process of getting yourself approved for regular Medicaid. I do just want to point out that that program changes January 31st. So Sunday, that program changes slightly. The form will still be available. You can still point people to it online. But my understanding is that if your income is higher than what it should be for Medicaid approval, you might not get approved for that temporary coverage. The other thing on a federal level that has really helped people stay on health insurance is the Families First Coronavirus Response Act had what's called a maintenance of effort provision in it. And the maintenance of effort provision essentially said states, you can have more Medicaid dollars if you won't throw people off of Medicaid during a public health emergency. So right now, people shouldn't lose their Medicaid if, as long as they don't move out of the state. People will lose their Medicaid, of course, if they pass away. They won't need it anymore. And people will also lose their Medicaid if they affirmatively ask for it to be turned off. But what that means is everybody else stays on, which means the state spends a lot less time deciding who gets health insurance and who doesn't, and who should be thrown off, and more time getting people on health insurance who need it. Meanwhile, families aren't constantly wondering, do I still have Medicaid? Did I turn everything in? Can I get to where I need to get right now safely to get all the stuff turned in to keep my Medicaid when they show up at the doctor? If they had Medicaid before, they still have it. Another big component to all of this that I don't have time to emphasize as much as I should is CHFS in Kentucky has worked relentlessly to make customer service better for these programs. The reality is nobody wants to go use a service that has awful customer service, right? If you have a bad experience, you don't want to continue to use whatever that thing is. So one thing that was happening pre-2020, pre-pandemic, is people were often waiting 3 to 4 hours when they called the DCBS hotline to get enrolled in a program or to update that program or just to ask a question about maybe something they received in the mail. And then sometimes you'd wait 3 or 4 hours and the call drop rates were high. So your call might get dropped and then you have to start over again. Or alternatively, the phone lines were so full that you never even got to wait in the first place because the phone line would just terminate the call after telling you that the phone lines were too full. This obviously disincentivizes anybody who works from actually using the programs because anybody who works can't wait 3 to 4 hours unless you have a job like I do where it's my job to wait on the phone with people with the Medicaid office. So right when the pandemic started, the administration, I think, did a really good job of essentially getting more phone lines open, expanding the call center hours. Now they're open on Saturdays, doing things that you do when you genuinely want people to take advantage of a program. They also instituted a notice improvement committee, which is a group of advocates and people that work within the agency who are working on things like, how do we make the things that we send people that are supposed to explain the programs and what people need to do, how do we make those things actually readable so that when you get them, you don't need a lawyer to help you interpret them? Although I'll tell you, I have received notices for people that I think I'm a lawyer and I don't understand what the agency is trying to get this person to do. So we're looking at all those and saying, hey, these have been edited and worked on by a lot of people over time. How do we look at them and really say, what is somebody going to think if they're unfamiliar with the ins and outs of these complicated programs when they get this? How do people really read this? Super important work that has to be maintained and be constantly updated as the programs change. And lastly, I'll just briefly talk about the redesign of the self-service portal. So Kentucky kind of had an out-of-date self-service portal called Benefind, which is how you applied for benefits and updated your case online. And it was working so poorly, honestly, that a lot of professional enrollment counselors that I know who do this for a living refused to use it and said they were using the mail and fax to actually get things done. Obviously, not the best way to get things finished in 2021. And so recently the CHFS rolled out a totally new and redesigned platform. And those things have to be maintained, just like if you're a business, you can't start a website and not do anything to it for 20 years. Well, you can, but it won't work very well. Those things have to be maintained over time. And so we hope that they continue to do this, but this is something that is going to move us to the 21st century. This new version is more mobile friendly, which is super important for a lot of people. Now we still have to keep all the other systems working because the reality is a lot of people in the state of Kentucky don't have access to the internet. And so they're not applying for benefits online and they need to be able to go in person or they need to be able to call on the phone and get a hold of somebody. But still investing in online systems for people that can access them is really pivotal. I'll briefly touch on the federal marketplace. Kentucky is, the Beshear administration has announced that we are going to attempt to move back to a state-based marketplace that we call Connect. I don't want to get deep into the ins and outs of why that's good, but just let me say that's a really positive move. We had a state-based marketplace before. It worked really well. People liked it. People liked using it. People felt ownership over their health insurance and like they were connected within the community where they lived to their health insurance. Lots of problems when we moved to a federal marketplace. It will also save the state money by moving to a state-based marketplace. Also, good news with the marketplace is yesterday the Biden administration signed an executive order making a special enrollment period for the federal marketplace from February 15th to May 15th. So if you know somebody that is over income for Medicaid or doesn't otherwise qualify and is uninsured right now, you should really point them to either a navigator or a CAC, and CAC stands for Certified Application Counselor, so that they can get enrolled in a plan if they missed open enrollment back in the winter time. I don't have a ton of time to talk about SNAP benefits and housing, but let me just say one of the recent good updates to SNAP is that PEBT benefits were just expanded, I think this week, by 15%, which means people that were receiving extra SNAP dollars because their child normally got free and reduced lunch at school, but isn't because they're not attending school because of the pandemic. Those people will now get 15% more benefits, which is 100% necessary. In terms of housing, the CDC eviction moratorium is still in place right now. That said, you've got to fill out a petition to take advantage of that. So that's a hindrance. That's an extra step that you have to take. And it doesn't prevent courts from still holding eviction hearings. If you know somebody or you are somebody who might get evicted and needs to fill out that petition and give it to your landlord, KEJC has developed a tool for that. And you should go to homerenterdeclaration.org to take advantage of that. You can take advantage of that in any state that you live in because it's a national tool. And again, it's homerenterdeclaration.org. We did have a utility shutoff moratorium as well, but it's been sort of piecemeal, lifted some. It exists in some forms, but it needs to be a lot stronger, particularly because we're in wintertime. Is the most important time to have access to utilities. And if we really want people to stay indoors and be safe and stay with their family in their dwelling, they have to have running water and electricity and those types of things to stay where they're at. So quickly, what are some things that we could do to make these systems even stronger? Like I said, we can't neglect these systems when the pandemic ends. We have to keep investing in the system and making these systems more, not less accessible. So we have to keep doing things like paying caseworkers, paying more caseworkers. So let's hire more people, but also we need people to stay longer because these programs are complicated. So if I call the Medicaid office and I get a person who it's their first day on the job, or maybe their third week on the job, they might not know enough to help me. But if that person's been there for 30 years or for 20 years or even for 2 years, they're probably a lot more helpful. They know a lot more about these systems that are really complex because they involve federal and state regulations and statutes. So we have to keep those people employed and trained, and there have to be enough of those people to make the system work. As far as Medicaid goes, we would love it if the administration would clarify that emergency Medicaid, clarify for providers that emergency Medicaid can be billed for COVID treatment, testing, and vaccination. And emergency Medicaid is for people who generally would qualify for Medicaid because of income, but don't qualify for some other reason, like their immigration status. Regardless of your immigration status, it's really important that you have access to testing and vaccination and treatment for COVID-19. We think that people should have access to that already under the regulatory structure that exists, but clarifying that for providers so they know, yeah, this is a mechanism we can use to bill for these things is really pivotal. For all of our programs, putting a stop to this obsession with working as a way to earn healthcare or earn food is so important. So I'm sure a lot of you will remember the Bevin administration attempted to put a work requirement on the Medicaid program that was unsuccessful a few years ago, that was defeated basically in court, but then ultimately the Bashir administration got rid of that by executive order. What does that do? Well, one of the problems that with the work requirement is this. The reality is people can't go to work if they're not healthy, and people aren't healthy if they don't have health insurance normally. So you create a catch-22. The other problem is that you are making the bureaucracy even more intense, because even if people are working, now they have to prove that they are working. In Arkansas, they actually implemented this plan. Tens of thousands of people lost their health insurance in a very quick period of time, and most of them still qualified for Medicaid. But because we'd added this extra, not we, but Arkansas had added this extra layer of bureaucracy that people had to get through, people just got thrown off because they didn't know how to navigate that layer of bureaucracy. Let's talk about SNAP really quick, formerly known as food stamps. Increasing the amount is so important. Sometimes when we talk to elected leaders about SNAP, or even people in my family about SNAP, right, they think SNAP is so much money for people. The reality is that the SNAP calculus of how much you get for a family is based basically on sort of getting a third of what your family's food budget should be. And then the calculation for what a third of that is, or what your family's food budget should be, is decades old, essentially. So the Biden administration has taken steps to update that calculation, but I can't emphasize how important that is, because the reality is a family of 4 is not getting what it takes to feed a family of 4 in SNAP benefits, even if they can make it through the rigmarole of getting SNAP benefits. It's also so important that our state leaders stop the obsession with who is worthy of food assistance. So this is already a problem at the federal level. The federal government has essentially made SNAP benefits tied to, or they made it very difficult for able-bodied adults without dependents to get SNAP benefits without proving that they're working or trying to afford work. Why is this a problem? Well, for one, the language itself is a problem. It's really racially charged. This able-bodied language is the same language that people used to advertise selling slaves. It's highly racially charged, and even if it's implicit, the reality is that it probably makes a lot of people think, oh yeah, those people over there that don't look like me or talk like me, or it conjures up images for people of who's really getting SNAP benefits that we need to keep out of the program. But again, if you're not getting enough food already on the table, it's unlikely that you're going to be able to get to work easily, right? So these things are not correlated, and we sort of need to keep them separate. And it's also, again, a real bureaucratic nightmare. Costs us a lot of money to measure who's working and who's not. There have been two bills introduced this session of the General Assembly, Senate Bill 65 and House Bill 161, that are attempting to enshrine a regulation and make it a statute that prevents people with child support arrearages from accessing SNAP benefits. Why is this a problem? Well, one, it's not going to be effective, right? If you can't afford food, you're probably less likely to pay your child support. Also, underlying all of these things is if you're taking benefits away from adults, you're almost always taking benefits away from kids, even if you don't intend to. So the reality is that taking benefits away from a household based on being behind on child support arrearages could affect a household that still has a child in it, probably not the child that's receiving child support benefits, but there could be another child in the home. Not only that, but I feel like it should just go without saying that we shouldn't be punishing people by withholding food from them. We don't even do that to prisoners, right? It's a bad idea. And on top of that, within the SNAP program, I feel like there's also sometimes an obsession with stopping fraud on the program, even though, and I don't have the statistics in front of me, but I'm sure Dustin could give them to you if you want them. The fraud rates in the programs as measured by FNS, who runs the federal program that runs these programs, are incredibly low, single digits low, very small. But a lot of people think, oh, well, I know this one person that I don't think should have food stamps, and so clearly everybody's cheating the system. And the legislation that is introduced about these systems indicates like that's the belief sometimes amongst our elected leaders. So last session, House Bill 1, which is the #1 priority in our House in Kentucky, was about essentially attempting to permanently ban people from using SNAP and other benefits for fraud. And fraud was defined in ways that it shouldn't be defined as, frankly. And then the bill also went on. I mean, the very first provision of the bill prevented people from using SNAP for alcohol, tobacco, vapor products, lottery tickets, purchasing things in a casino, purchasing things in an adult-oriented entertainment center. All of these are places you can't use your SNAP benefits already. So why introduce legislation like this? And again, I think it's about that shaming, about convincing the public that this is what's really happening with public benefit dollars, even though the data and the reality don't match up with those things. So we spend a lot of time trying to police programs to keep people out of them, rather than making the programs easier for people to access. And I just want to point out with that too, the absurdity in that House Bill 2, which is the second priority that session, was about stopping human trafficking, right? We thought it was more important to stop people from using public benefits than it was to stop human traffickers. I could talk about this all day, but I won't. Just to wrap things up on my end, because I am a little over time, sorry. But housing, we need to extend the eviction moratorium and make it more robust than it is currently, easier to access. You shouldn't have to fill out a petition. We just need to stop the eviction hearings in general. We need to adopt the Uniform Residential Landlord-Tenant Act in the state of Kentucky. I could talk about this all day. I won't, but we are one of only 2 states in the nation without uniform landlord-tenant law. So even when there's not a pandemic or a crisis, people are not protected by our laws in the state of Kentucky. Finally, cash benefits. One of the easiest ways for people to actually take care of their needs is giving them cash benefits. But in the state of Kentucky, TANF dollars or KTAP dollars, very few families receive those. You almost have to be destitute and earning almost nothing to take advantage of those. Not a lot of families can take advantage of those. But the reality is there's no other way to do things like help a family meet the needs of the clothing needs of a child in school, or pay for a field trip, or take care of something other than food in their home. And so cash benefits are incredibly important, but we won't expand those to people if we don't trust public benefit beneficiaries to be smart with those dollars. And so I will just reemphasize, we have to trust public benefit recipients, and we do that by thinking of them as just like us. Like at any time we could need to use those programs, and we want people to trust us. And so we should trust people with benefits as well. The very last thing I'll say, as I talked earlier about being a little bit jaded about things on election day, and I'm sure a lot of you were also encouraged by the poem that Amanda Gorman read and performed at the inauguration. But one of the things that she said that has been giving me hope about these benefits programs is the phrase, "a nation that isn't broken, but simply unfinished." And I encourage you not to take from this that our public benefit systems are just broken, but that they are unfinished and they still need work. And we should still be a part of and do that work. Thanks.
Well, I can't think of a better way to end than with poetry from our youth poet laureate. I'm really grateful for the information that both of you shared with us. We have a couple questions that I want to aim at both of you. And so if you want to come back on the screen real quick, we can spend a few minutes answering some of these. The first question, I'll open it up to both of you. I think it's specifically around public assistance, but I'll include unemployment insurance as well. Is there anything we should be asking for in federal relief, like Biden's proposal, for example? I'm assuming that means his legislative proposal that would improve public assistance. So what are some ways we can utilize federal legislation or federal proposals to beef up our public assistance programs? I'll let either one of you take that first. I'm sure you have plenty of ideas.
Can I just ask as a clarification, Dustin, are we talking about like long-term or just like right now?
Why not both? Let's think big.
Well, I guess a few things. As far as housing is concerned, I know that I haven't read as much about this as I'd like to, but I know there's been some discussion about making Section 8 housing vouchers an entitlement program. In order to do that, we have to improve the housing stock because there's not enough Section 8 housing if we actually gave vouchers to everybody who needs it. But affordable housing is such a big component of making sure that people can continue to live where they live in a pandemic. But also, so many Americans can't afford to pay their bills because they're paying so much in housing costs. And if you've had to find an apartment, I don't know, in the last 10 years, you've experienced that on some level. So that would be one of the things. There are so many federal barriers. I mean, even when we're talking about changing notices, there are so many things we have to keep because there's a federal regulation or statute that makes it more complicated to keep that. So eventually dismantling systems like the ABOD work requirements for SNAP and all of these like barriers, and particularly all the barriers that involve counting people's assets and keeping track of those things. Keeping track of assets, like who has how much and what, is so complex that when the Affordable Care Act was passed, we just took it out of enrolling people in Medicaid based on their income, because we realized that most people that have less than 138% of the poverty line in income, they're not driving Ferraris. But I have so many clients that spend so much time and get kicked off the program, like proving the interest on their savings account that has $1,000 in it, maybe it has $500 on it. And we're trying to get statements from the last 3 months showing that that checking account is only accruing 2% interest because we've got to show what assets they have. It's such a pain. And there's so much data entry and so much state dollars spent on that I would love to see that dismantled in statute over time, or tomorrow. Tomorrow's fine too.
Yeah, the example of that I always point people to is before the internet, caseworkers had to actually have a copy of the Kelley Blue Book on their desk so that they could assess the value of a family vehicle to see if that pushed them over the edge.
I can't tell you how many fights I've gotten in with public benefits agencies about how much a car costs. Like, actually, does it run? Like, what's the Kelley Blue Book value? But then does the car actually run, or is it just sitting on cinder blocks in their driveway?
Michele, how about you?
So yeah, with unemployment insurance, immediately, so we already have a benefit cliff coming up March 14th. In order to avoid that benefit cliff, legislation needs to happen by February 14th because it takes states so long to program this stuff into their computers. I don't see that happening. So we're hitting a benefit cliff in March. We need to extend benefits. The president's proposal said through the end of September, maybe the end of the year. I would like to see retroactive additional federal pandemic unemployment compensation going back to before the end of December. That may be unlikely, but it's worth asking for. You know, that should include enough weeks and an increase. So what the president proposed was a $400 additional benefit right now. From January through the end of March, it's $300, right? But 400 seems more appropriate to make sure that people have the economic power to turn down an unsafe job that will continue to spread the virus. But we need to talk about long-term reform now. We need to talk about automatic stabilizers. We need to talk about triggers specifically so that when unemployment gets to 5.5, 6.5, 7.5, 8.5, 9.5%, at all of those points, additional weeks get added to unemployment, because we saw this in the last recession. We saw this in the recession before that. It's even worse now. Congressional gridlock is just devastating to regular people whose benefits get shut off for weeks every time there's a disagreement in Congress. The other thing is we really need to start talking about a more robust federal floor, maybe even a much bigger federal role in administering benefits, because as long as states have the power to mess with benefits behind the scenes, they will do that. And you know, a minimum of 26 weeks, minimum replacement rate, you know, some access bells and whistles, like making sure that good cause quits are all very good in states, and that people can leave terrible jobs or can leave jobs if they have compelling personal reasons. And, you know, make sure there's a dependent allowance in every state, require work sharing. You know, there are a lot of federal reforms that can happen. I mean, ideally, like a lot of people in DC are starting to say, just federalize all of UI. States were given this, they couldn't handle it. You know, it's just become a race to the bottom. I tend to agree with that, but I'm not sure that can happen in the next year. So, you know, in the short run, we should at least establish a much more robust federal floor for benefits.
Yeah, I agree with all of that. Sherry is asking a couple questions here. The first is, has the state considered using public information, local TV ads to help reset beliefs to combat some of the false narratives that we mentioned? I don't know that, Betsy, you or I have an answer to that, but I think it's a great idea. So unless you have something specific you want to say about that, I can move on to the next question.
I was just going to say, the only thing, Sherry, that is even closely approaching that, like the last TV ad campaign that we had, was the 1, 2, 3 Free For Me campaign, trying to get really as many people of color in the state to take advantage of Medicaid specifically. It's a great idea in theory, but the reality is that a lot of people don't access public benefits programs for a variety of reasons, and it's not because they don't know that they exist. Some people that might be true for, but yeah, you're right, there's more to it than that.
I also think some of the messaging behind the governor's press conferences early on in the pandemic were really helpful in pushing back against that. And some of the messaging when we rolled out the announcement about Connect and how it was going to integrate multiple benefits into one platform, I think that was also helpful. The other question is, do we see problems with continuity of benefits for people at or near thresholds, like between ACA and the healthcare.gov plans?
Yes, the short answer is yes, we do. There's a problem with people turning on and off of those systems. I was just talking to a friend recently who moved from like working for a company that provided her insurance, and she decided to quit that job and start doing essentially gig work, like she's doing freelancing work. And it was so hard to sign her up for health insurance because Medicaid and the marketplace require you to give very specific, they essentially require you to estimate what you're going to make for the next year. which is really hard for somebody who just quit their job to do freelance work. How are you going to guess what you made for the last year? And so estimating that for a lot of people, for people that work off tips where your monthly income changes month to month, for people that pull up part-time jobs frequently, who are working a full-time job but then supplementing that with seasonal labor, it becomes really difficult for them to stay on the systems. And unfortunately, I hate to say this, but I've had to tell people who are close to that line sometimes that you probably shouldn't use this program because you're constantly in the state of, not for Medicaid, this wouldn't apply, but for SNAP, this does apply, constantly in the state of being overpaid and having to pay it back because the agency didn't calculate something right because your income changes so frequently.
Michele, you mentioned earlier modernizing IT for unemployment systems, and Kentucky has an RFP out for a new modern system to replace the one that we first built and haven't really updated since Nixon was president. I'm interested to know if you have particular principles that should go into a system like that. Betsy talked a little bit about some of the upgrades to the self-service portal for social safety net programs. I'm interested to know if you have some principles like that for unemployment insurance.
Yes, and I have a paper out about this that I'm happy to share with whomever, but I think there are some initial principles that even before you get to an upgraded system that you could implement really quickly, which is make it open 24/7, have good password reset protocols so that people don't get locked out for a week or something before they can get back in. Have materials for people with limited English proficiency. Make sure that the systems are disability accessible. UI is particularly ableist in a lot of ways. You know, it's in the statute that people have to be able and available to work, but it's sometimes unnecessarily ableist. The other thing is, it's just, and so then moving into full IT reform. So what a lot of states, what almost every state has done when they upgraded their IT system is they were really concerned about the back end and making it easier for the state agency to process claims. But sometimes they would just take the front end of the old system and just plunk it into the modernized system. And I don't know if you've been through any of these questionnaire sites, but I half expect the next screen on some of these UI sites to inform me that I have died of dysentery. They're so outdated looking, you know. So I think, you know, making sure that the user experience is good has to be part. I mean, there should be user testing before the thing comes out. And actually, advocates should be a part of every step of the process. They should be working with communities of color, rural folks. Oh, the other thing that can be done more quickly is making sure that the website is mobile optimized and that documents can be uploaded from a mobile phone, because people, particularly in rural areas and stuff, don't necessarily have don't have a good broadband or a solid desktop computer. Just making sure that the users are part of the process is really the most important thing.
Yeah, I've heard that referred to as human-centered design, which seems like it should be a no-brainer, but I think that's really helpful. Betsy, you mentioned a couple of bills that have already been filed around child support arrearages. Are there other bills around, health care assistance or food assistance in the legislature this year that you are either worried about or that you anticipate that we should be thinking about?
There probably are more than I'm gonna think of right now, in part because I'm still like brushing up on what's happening after being out for so long. One that comes to mind right now, well, a few things that come to mind right now. A lot of what the legislature is doing right now, as we all know, is trying to strip the Bashir administration, or just the executive for now and all of time, from having emergency powers. I don't know how to say this any more straightforward, but it's a bad idea. we don't want to have to call together the whole legislature and everybody agree about how to fix an emergency. To me, it would be the same as essentially having a rule that when you come into the ER, all the doctors that are on staff have to agree about the right course of treatment before anything can happen. It just will end up with you probably dying on the table in the meantime. And I think it really has more to do with politics than what's good for people. So that's of concern to me, because a lot of the things that I just described that are really good ideas would not have happened but for that. Another concern that I have that is related to sort of health in general, and I think will make a difference for people on public benefits and otherwise, is this bill that is proposing to get rid of any immunization requirements that anybody has. As somebody that just had a kid in the NICU for a week, I cannot imagine the nurses in that NICU not being required to be vaccinated. When my kid, you can't vaccinate a newborn. So I don't have that option. Well, I mean, you can for certain things, but not for a lot of things that you're really worried about. So not being able to require teachers, healthcare workers to vaccinate is just like an overreaction to giving people freedom of choice who maybe have some sort of like religious objection to taking a vaccine. Those are the things that are on top of my head. I'm sure that there are a bunch more, but I still need to catch up some.
Michele, you talked a little bit about the unemployment insurance loans that states have had to take out and some of the reactions in the past to large loan balances. Aside from, let's say, Congress doesn't come in with sort of a rescue package for states who have had to take out large loans. What are some things that states have done to either try and pay off that loan more quickly through cuts, or pay off that loan more substantially through adequate tax systems?
Yeah, and there's actually a third option, which is to bond it out. That states have taken, and they do that because eventually interest will be charged. Right now, interest is waived through March 14th on UI trust fund loans, but eventually the interest will kick in. And if the loan is out long enough, FUTA taxes go up for all employers in the state by a few dollars, and even a few dollars really seems to draw ire. So it could be bonded out. I think the best answer is obviously, not cutting benefits, because you need those benefits to be available and to be robust when there's a recession, to keep the economic pain from spreading to unaffected sectors. And that I think that's part of what we saw when the $600 and then the $300 ran out, is unemployment started to creep back up again, because people had no spending power, and so that affects other workers. So yeah, I mean, I think the reaction to having a loan is to pay it off, as crazy as that sounds, by taxing employers.
Yeah. Well, I really appreciate the time that both of you all have shared. Betsy, I'm super appreciative of you coming back 2 days after maternity leave to jump in the middle of this. Is there anything else either of you want to share before we sign off for today?
I feel like I didn't take the opportunity. Sorry. One bill that I didn't say, Senator Neal has a bill to look at health impact disparities, essentially requiring bills that might impact Kentuckians' health, making us actually take a second look and say, how will that actually impact people's health, which is super important from like a racial equity standpoint too, of who's this going to affect and how. And I would love to see that move further this session. It was introduced last session and he's made some changes, and I think that would be really great for public benefits recipients, but for all of us. Absolutely.
Yeah. Michele, any other parting thoughts?
No, but thank you so much for having me. This has been fun. I really learned a lot from you, Betsy.
Same to you, Michele. Thank you guys so much.
Well, I learn a lot every time I talk to either one of you. So I really appreciate your time. I know it's precious right now. For those who are still with us, keep an eye out in your inboxes for a follow-up email with some of our materials. and also a questionnaire because we really like feedback. So we're appreciative of everyone that joined us today, and we look forward to continuing the fight for economic and racial justice. Thank you all.